get started. Hello and welcome. I'm Rena Large from the Early Childhood Funders Collaborative. Thank you for joining us today for this discussion on advancing state capacity for equitable and sustainable early childhood systems. We're so pleased to be hosting this conversation with Heising Simons Foundation and the W.K. Kellogg Foundation on the importance of early childhood governance as a lever for creating impact and the role that private funders can play. We're really excited to be hosting this discussion. We're going to learn more about the Early Childhood Governance and Financing Initiative. Joining us today to talk a little bit more about that, Rebecca Gomez from Heising Simons Foundation, September Jarrett from Heising Simons Foundation, and Harriet Dichter, who is the lead on the project. We're also going to learn a little bit more about two places where the project is working. And joining us, we have Maribel Loste from the Commonwealth of Northern Mariana Islands. She's in the Child Care Licensing Program and Child Care and Development Fund. And also joining us, Libby Saunier from the Louisiana Policy Institute for Children. Both of these places are contextually different, but both have fascinating lessons to share that are applicable to other places. So we're really excited to jump into this conversation. With that, I will turn it over to Rebecca Gomez to get us started.
Great. Thanks, Serena. Thanks to ECFC for hosting us. Thanks to my state and territory colleagues for taking the time, particularly to Maribel, who is on quite early with the time change. So we appreciate you for that. And Libby for taking the time as well. And thank you all for joining us today. So I'm going to get right into the overview of our project, and I'm going to share my screen. All right. Can you all see the slide? Just a thumbs up. Yes. All right. So I want to start by grounding us in how we at the project define governance and financing. I think it's a little bit maybe different or more comprehensive than the traditional definitions that you have heard in the field. And we start with the notion of a unifying governance structure. And I think this is the beginning point for us. You have to house your approach to system management somewhere. It doesn't have to be within a single agency or organization, but you have to have some kind of structure and articulated way of crossing structures or agencies if it's not a single structure. So we're structure agnostic. What we're really interested in is the three other boxes that you see on the screen here. In particular, thinking about the processes for how power within the governing entity is exercised, how families and practitioners are engaged, how community members are given a voice in the decision-making process, and thinking about how we make decisions that are responsible and responsive to issues of concern to a variety of stakeholders in your early childhood system. We're also pretty clear that a good approach to governance has a number of functions. So you could think about the functions such as fiscal allocation, allocation of human resources, setting standards, regulating. I could go on, managing data, using data to inform policy decisions, engaging with the community. I'd love to talk about governance functions, so I could go on, but I hope you get the picture that part of our thinking on governance is not just structure and power and accountability to power and for power, but how your governance entity functions within those responsibilities. And then the last thing I'll say on this is that we think about the whole system. And so we're really thinking about integrated governance and bringing coherence across the various programs, right? You all sort of know that there are many programs and funding streams that touch young children in the U.S. And so we're thinking outside of just the governance of any one of those programs and really thinking about how do you bring these together and govern across the system for those outcomes for kids, families, the workforce, and communities. How do we think about financing? And so you can sort of see our approach here. Again, it's thinking holistically, it's thinking across the system and not just fiscal management of any one program, but thinking about all of those programs and the different funding streams attached to them, thinking about how it's allocated and administered, and then derived from the National Academies of Science Transforming the Financing for Early Childhood report. We're thinking about consistent high quality standards for how financing is allocated and distributed, cost-based payments, and that access to early childhood is not dependent on family circumstances, parental employment, or any other characteristics. We're thinking about financing that works both for early childhood practitioners and programs on the supply side and families on the demand side. We're thinking about coordination of funds across all of those different public sources and levels, federal, state, and local. We're thinking about the sort of behind the scenes system infrastructure that has to be there to take in the funding, to allocate it effectively and move it out. And then lastly, we're also thinking about revenue generation. And September, my colleague who leads us on the financing piece, if I've forgotten anything, please jump in. Um, I want to talk for a minute about strategies. For the project. So this is a project, and our colleague Nara Top from Kellogg sends her regrets, but this is a project that Kellogg and Heising Simons came together to try to think about how do we best support the early childhood field in thinking about functional approaches to governance and then the financing piece coupled alongside that. So we started the project in 2019 with some landscaping, and then of course COVID hit, and we saw in real time that states, territories, and tribal nations really struggled with getting those relief funds out, with being able to respond in the way that they wanted to, or would have wanted to, for kids, families, and the workforce, and that helped us sort of reinforce the idea that we wanted to continue with direct investment in states, territories, and tribal nations. And that states, territories, and tribal nations, they understand their own context. They understand their own sort of the people living within that geography. They have a set of culture and values that are key and should inform the approach to governance and financing. And this depends greatly on the geography and the different cultures. And so we thought um, one of the best ways forward was to just offer that direct investment to the states, territories, and tribal nations themselves and sort of provide support that was really flexible and let them think about what reform would be the most resonant and best way forward to serve the populations that they're working with. So direct investment is our first and principal strategy. We offer as much peer-to-peer learning across our subgrantees as possible, thinking about the fact that states, territories, and tribal nations, when we offer the opportunity for them to get together, they've said it's really valuable. They like the semi-structured time to really be able to share ideas, thoughts, brainstorms, and challenges with each other. It's something that they don't get often in other venues. And so we continue with that as a project strategy in different ways. The third strategy is really building capacity to support the field. So governance and financing to me is still a sort of an understudied, undervalued, and underutilized approach to thinking about reforming the early childhood system, particularly if you want to create a system that centers equity at the core. And so we are thinking about how we can enhance the capacity of national organizations that work on either governance or financing, build their benches, and connect them as it's relevant with the states, territories, and tribal nations that we might work with. The final project strategy is knowledge development and dissemination. So to my previous point, this is an area that's really, I think, ripe for more intervention, more research, for storytelling. And so we are working on a variety of sort of knowledge production endeavors, including an evaluation that's co-developed with our project grantees in the states and territories that we're supporting. We are working on a book focused on governance and financing and trying to tell the story of the work that we've supported and thinking about how to sort of codify the next frontier and thinking here. And then many of our states and territories, with the support and leadership of Harriet, have participated in conferences and convenings to start to be able to talk about their work and lessons learned. So I'm going to stop there and pass it to September to talk about why this is important to us as a foundation.
Yeah, thanks, Rebecca. That's a great overview. I'll just briefly say on behalf of the Heising Simons Foundation, we believe in a system of early learning and care in which children, families, providers, practitioners, educators, and communities all thrive. And I will say we continue to advance federal policy, and we believe in federal domestic policy, which deeply funds early learning. Um, and we believe that states, tribes, and territories will have and will continue to have a lot of agency and say in their early learning systems, including how decisions are made, how funding is distributed, and how systems improve over time to meet changing needs and conditions. A simplified analogy of our why about governance and finance and why we're so proud to be a part of this project is a plumbing system. Think with governance as the pipes and financing as the water. No matter how much water or how little water is moving through those pipes, you want it to move quickly and freely out the tap to get to the right place in the right time when it's needed, with no water leaking out along the way. Early childhood systems that are well governed and financed do just that. You know, under the cabinet in my house might be a lot of pipes, it might be a little pipes, there might be big pipes, there might be small pipes, there might be PVC pipes, but the point is such that we really see early childhood systems that are well governed with the communities they serve, sort of sharing power, making decisions, are the best informed to have the biggest impact on kids, families, and providers. And so that's our why. It's hidden work and it's often hidden infrastructure, as Rebecca said, but I like to think about it as small, big. These are small changes or behind the scene changes that can have really big impacts in the communities in which they serve. And with that, I think we should hear from the leaders of a state and a system to really understand the impact of governance and finance in their unique conditions.
Thank you, September. That was great. That's the first time I've heard you talk about the work as plumbing. So that was good, but all the pieces have to fit together. So I'm going to just take a few minutes to say a little bit more about CNMI in Louisiana. But as you all know, this webinar today is really focused on hearing directly from the important work that Maribel and Libby have been doing. So our focus is on this direct investment work. And Rebecca said what's been a very important value to us is actually locating expertise in the states and territories we're working and really not saying, hey, we think you should do X or we only want to fund Y. So in CNMI, we're really pleased to be able to work directly with the government who basically, Maribel will talk more about this, but it's going to talk about her work in rural communities and across their very culturally diverse islands that had childcare deserts. And so Maribel's prime focus, I would say, has really been financing as she looked at supply shortages, actually profound supply shortages in their childcare supply. And also, for those of you who know Maribel, she has a very deep commitment to quality. So I think her story of basically how she's been able to benefit from this and what she's been able to do will be really interesting. But our project has not just worked with people in the government. We know that the work on financing and governance can happen in multiple places. And because this powerful context issue is just so important, Libby is here representing a nonprofit policy organization who has worked in that role to help open up state government, to have more influence from family members and from providers, and has also sought ways with the legislature and others to really have revenue expansion that actually balances between state contribution and local contribution, and also to be forward thinking. What would be a better way, basically, to have funding distribution be able to occur? So we're excited basically to hear from each of them. And we have others. It was hard to try to figure out for today's piece, basically who should come, because every story of everyone we're working with, they're unified in terms of the deep commitment and picking off what is appropriate in their own context for trying to move the agenda. But this is what we have here. And so I think Rebecca's going to kick us off in terms of our first question.
Yes, thanks, Harriet. So we're going to do what will probably feel like a lightning round series of questions. And for the folks on the call, just a heads up, we will leave about 15 or so minutes towards the end for just open discussion. So if you have questions, you can put them in the chat and we'll try to sort of catalog them. But we are going to focus on our panelists to start out to let them sort of tell you about their story and their motivation. So I'm going to start with Maribel, and then Libby, you'll be second for this question. You've got 2 minutes each, just as a time reminder. Not enough time, but tell us a little bit about what need or challenge you were aiming to address through your connection to the Early Childhood Governance and Financing Project.
Hi, good morning, everyone, and thank you so much for this opportunity to share our story. I'm not sure if the slide would go up. I'm sorry, I don't see the slide. So, but in the CNMI, so just as background, we are made up of 14 islands, and majority of the services are provided in the major island of Saipan. We also have services being offered in Rhoda and Tinian. And so our initiative of system of support was really primarily to address the childcare deserts in the islands of Rhoda and Tinian. We had noticed for many years that families were applying and getting approved for subsidy, childcare subsidy. Unfortunately, there were no available providers. At the same time, we also are very heavily reliant on what's called temporary CW workers, which are this type of employment or this type of workforce permit is set to end in December of 2029 with no possible opportunity to renew. And so we wanted, as part of this initiative, to be able to increase the number of our indigenous people in childcare, thereby building our local capacity. Thank you.
Maribel, can you see, am I on the right? I put
Yes.
the slides up. You're okay. Okay. Just tell me when you want me to, if you want me to go forward for this part.
Yes, I'm good. Thank you.
Thanks, Maribel. Libby, will you share with us?
Sure. So our vision in Louisiana is really to have an ECE system that is equitable, ensures that all families have access to affordable, quality early childhood education that really does meet their needs. And we have five big components of that vision. One is equitable access. The other piece is around workforce compensation, stability, and quality, as well as advancing quality with equity. And the fourth piece is around sufficient sustainable funding, and the fifth is around family and provider voice. And so we fundamentally believe that those who are most impacted by this system are the best able to inform policy and the practices to transform it. To your point about governance, like I had to write down small, big. It's those small things that have a really big impact. And so by focusing on these equitable approaches to ensure that families and providers have a voice in the governance system, as well as helping us think about how do we develop sufficient sustainable funding to build an early childhood system that achieves what we all agreed that was so important to us. And so for us, that really requires building capacity of local levers and people to better represent the diverse needs and the regional differences across the state. Maribel has all these islands, and they're all unique in their way. And in Louisiana, we have North, Central, and South Louisiana, and they're all different too. And so how do we really take into effect these regional differences across our strength to strengthen the state's role of, arbitrating like redistribution of resources that provide extra supports to communities. And so for this project, which really transformed into our Go Far Louisiana work that has, 5 pillars related to what does an early childhood system look like that's equitable and meets the needs of families and children, we were really thinking about how do we establish a sustainable model for equitable governance. And so how do we build a bench related to ensuring that we have families and providers that are ready to step in to these different models of governance in our state? How do we also create a robust financing system for early childhood education that ensures access, affordability for families that's also with consistent quality, and our workforce is stable and well compensated, which is, as we all know, can be quite complex and hard to do. And then the third piece around for us was really about assuring alignment across our partners, agencies, as well as governancing and financing strategies to really maximize the resources that we have and to align the system in which we work.
Thanks, Libby and Maribel both. I get so excited hearing about your work every time. Libby, I'm going to climb in and you're really clear about sharing power and involving impacted communities of parents and providers in the decision making there in Louisiana. Can you share a little more about where you started and your progress to sharing power with impacted communities there?
Sure. So I think where we start is where many other places start, is that we say we want to involve parents and providers in our governance structures and our decision-making bodies, and they are there in figure. So you might have a statewide governance body that you have parents, but that parent may also be an agency person. And so they're not always the people, always the families and providers that are closest to the system and either working in the system or taking advantage of, the resources the system has to offer. And so what we've really done within our body of work is, one, build a bench. We're also able to work with the disability community during one of our legislative sessions to say, hey, y'all are really worried, and rightfully so. How do we make sure that public meetings are accessible to you, and that you don't actually have to come to the Capitol to be a part of a governance body? And so with the disability community, we were able to change state statute related to public meeting laws. That's a first step. We have a longer step to go for all people that are involved in our early childhood system. So that's one piece. The other piece is we've been able to really ensure that we have providers that are taking part of our system in these governance bodies. And so when it was time to reappoint people to boards and commissions and councils, we made sure that we were getting the word out to our provider community. The other piece too, if you think about when CCDF came out and you had to write your state plan and you had to do all these things, we helped really galvanize a group of providers to say, what are the things that you want to see in our state plan? And that was the first time in the state of Louisiana that providers showed up in force in an organized way to say, these are the things that we want to make sure that are in our CCDF plan. And we're sorry if it's repetitive, but that's how important it is to us. all at the same time listening to our steering committee with our Go Far Louisiana initiative, which is made up of over 36 individuals, and the majority of them are families and providers in the early childhood system. To listening to them, if we didn't have the right balance in our community that we built to be a model of like how this thing can work in government and in communities, that we listened to our providers and families, so much so that we held our first Dad's Day at the Capitol this past May. It was incredible, and have been able to form a fatherhood task force with other partners throughout the state. And so it's really building the bench, making sure people that they know that they have the power and the agency to be in the spaces that they should be in. Because again, we fundamentally believe that the people that need to be helping us make the change, are the ones that are most affected by the policies that are put in place. And so really the heart of this show is that we work with people instead of doing things to people. And that has been a fundamental change that we've seen. It gives me chills to talk about it, because to watch our families and our providers just light up like Christmas trees, because they know that they've got the power to be able to do what they need to do. And they're impacting change, not just for their children, but for all children in the state of Louisiana.
Thanks, Libby. I think you're giving us all chills with that too. I think we all, I shouldn't speak for everyone, I'll speak for myself. I think the idea of, instead of being done to, but sort of building that system vision together and what people want, like that's my vision for government and governing. So thank you for that. I'm going to shift us back to Mary Bell now. Can you tell us a little bit about why you chose to focus on financing in your work, where you have 2 entire islands? You talked about this in your intro, where there was no childcare available, and that was part of your CCDBG childcare assistance program. Can you share a little bit more about this approach and your progress to date?
Sure. Every time I think about how we started the system of support, and really those words describes the way that we provide the services to the other islands, Rhoda, Tinian, and of course, including Saipan. When we started this back in 2019, we really did not see the impact. We just wanted to provide the support. We wanted to make sure that families had access to childcare. And coming to where it is now, we started back in 2019, we had 5 providers, CNMI wide. Now, as of last counting, last reporting, we are at 58 home-based providers, including licensed and license exempt providers. And so what have we done to provide support to our providers? And just like what Libby said about listening, we did a lot of listening. Every time we go to the different islands, it is customary to visit the mayors and also to have an opportunity for the community to meet with us. And so we really did listen. And a lot of the conversation centered on, in terms of providers, we can't afford this, Maribel. The business license is expensive. We don't know, we need to get all of these requirements. I don't know where to go. Who do I need to speak to, et cetera, et cetera. And so that's how we were able to put the system of support together, by making sure that we have a way for people to help people where to go, get the forms that they needed. If they had a question, is there somebody, a live person that they can talk to explain to them all of the forms, including really directing them, of course, we are a small community, to the person that could help them at that particular agency. And so with the system of support, we do provide reimbursement of the provider's first year business expense. So this would include business license, police clearances, health clearances. And then, of course, we want them to succeed. And so our providers do go through the strengthening business practices training. And after that, obviously, would be, of course, heavily on coaching. All of our trainings and TA are free. And they can access them anytime. They just need to connect to their what we call FACES, and these are our family and community engagement specialists, who we are very fortunate enough to speak the native languages in the islands. And so we think that that's a very, very important piece, because when someone is able to speak my language, then I am able to build a trusted relationship with them. And so to also include on this one would be, as I mentioned, coaching. And so through the coaching, providers are able to feel comfortable talking, and then also talking to their faces, talking about their issues. How do I meet these requirements, and very comfortably be able to meet those requirements. And so just most recently, our office just received the completed report on their pilot. So we went through a pilot on our quality recognition and improvement system, because now all of our providers include both center-based license, and all of our home-based providers are now going to be part of our quality recognition and improvement system. And so you will notice in front of you the increase in our providers per island, starting back in 2019 to where it is now, 2025. And then also for our home-based providers who participated in our QRIS, a total of 39 were able to successfully go through our pilot. So very excited, and I can't wait for our next steps regarding quality and also support to our providers. Thank you.
That's really inspiring, Maribel, to see the progress and the scope. I'm going to shift to you, Libby. You were so eloquent about how you're working differently with parents and providers, but there's so much you're doing on what you're working on, including financing. I've been kind of intrigued to learn about your local state financing model there in Louisiana, and I was wondering if you could maybe share your work on financing, in particular that local state match.
Absolutely. I'm going to share my screen so that you all can see this. So one of the things that was created back in 2019 in Louisiana was an early childhood education fund. And at the time, it was for every $2 a local brought to the table, then if there was enough money in the fund, there would be $1. And that was in 2017. In 2019, we were able to change it to a dollar for dollar match. And so, through the work with the governance and finance work, it's really made us think about how do we utilize this fund to help people understand that it's not all just federal money that needs to come into the system. It's not all just state, and it's not just local, but it really is all of us. And at the end of the day, that's good government. And what does that look like? And so we've been fortunate, as you can see on the right side of your screen, that the Early Childhood Education Fund now has funding sources from revenue from the fantasy sports betting, as well as industrial hemp, the New Orleans Pelicans license plate, interest earnings, one-time state funding, which happened in 22-23 in land-based casinos. You can go to our website and see this funding dashboard. We update it monthly. So this dashboard was just updated September 3rd, because we get a report out from the Treasury. And so what the fund has helped us to do is that talk to locals about how do you generate revenue that's not federal flow through dollars, but how do you generate funding locally? Because we have these we call them Ready Start networks, which are early childhood community hubs. And one of their pillars is to fundraise. And what I tell people all the time is we're not talking cake sales. We're talking revenue generation. And so how do we think about revenue generation? And so in Orleans Parish, where New Orleans is they now have a millage that we helped work with them to pass of $21 million a year for the next 20 years for birth to three quality early childhood education. Now, because we have that fund, because we have the fund, that then goes to 42 million if there's enough money in that fund. Since then, we've worked with a number of the local parishes. We have parishes in Louisiana, not counties. But we have worked with local communities to think about how do we generate the revenue, and then how do we utilize that generation of revenue to then go into and access the fund, all at the same time working with our Louisiana Department of Education, where our early education is housed, of like around rulemaking, around statute interpretation. And let me tell you, they interpret things differently. And so how do we have that conversation with the locals that are generating the local dollars of like, this is not how we read the statute. This is not how we read your guidance document on the fund. And how do we work through that together? And so you'll see when we first started back in 2022, 21, we only had one parish, about 3 parishes. We had Orleans, Jefferson, which is right outside of New Orleans, and then this little dot right here in Caddo Parish, where they went from a couple $100,000 to getting up to $2 million to be able to generate revenue. And so when we talk about it being equitable, these are the things that we're thinking about now. We were always thinking about it being equitable, but as Harriet has worked with us for a while, and we would always talk about, what about the parishes? What about the locals that don't have a revenue base from which to pull from? What if we were able to, at some point, to get the revenue so high? It's a dream. How do we get the revenue so high in the fund that we can meet the needs of the locals that have generated their own revenue, and then equitably distribute to the parishes that are not able to generate their own revenue? But here's the kicker right now, is that you'll see a little over $36 million that is in the fund as of September 20th, at September 3rd. And you'll see here that for fiscal year 25-26, there's almost a $30 million request of locals that have generated revenue. So what does that mean? That means we've done a really good job, but that the need is outpacing what's in the fund. And so we're having to have really finance conversations as well as governance conversations around what happens when we run out of money in that fund, and how do we meet the needs of locals that have raised the fund. And so on our website, you'll see, you could go back to see where the money has come from over time. So in 21-22, we had a one-time investment of for almost $42 million, and then there hasn't been any more one-time investment. And then over time, you'll see about what we were able to generate over time. This work has now led us to really think about, what does a sustainable funding formulary look like for our high quality early childhood system? And so we've just started tinkering with that work, but not doing it in isolation. So working, with partners, and then going and trying to figure out how we would field test this if we're able to figure out the funding formulary work. Because K-12 has a funding formulary. Now, it can't look the same as early childhood, because the community needs, whilst they're the same communities, but the needs in early childhood, birth to 4 are different than the K-12 system and how they fund it. And I often say this, we wouldn't think about not funding 4th grade, but we do think about not funding a 4-year-old or a 14-month-old or a 4-month-old if that family wants to access early childhood education. And so as we're thinking about, like, what does a funding formulary look like? As we think about the financing pieces, it's also like, what are the weights that need to be in the formulary to meet the needs of the community? And so it's not just state down, but it's really locals up. And how do we meet in the middle? We haven't figured it out yet, but the mind exercises and the math behind it is very cool. And at the same time, talking about this in communities that are already accessing the fund and other communities that want to access the fund. And as we think about the formulary work, how do we not disincentivize locals that are able to generate revenue? And so the complexity is immense, but I think it's a real opportunity to meet the needs of families, meet the needs of providers, and meet the needs of the state and the diversity that we have within it.
Thanks, Libby. It's such a powerful example of the complexity, but also we talk a lot of times top down, bottom up when you're trying to deal with broken systems. And it's a really powerful bottom up example. So thanks.
I would echo that. Thanks. And as I have 4 teenagers, they would say you're both posting W's in the chat. Speaking of chat, I want to open it up to, that's my terrible segue. I wanted to open it up to the folks on the call. We have time for 1 or 2 questions about this work. Our panelists are doing really deep, like long-term system reform. And so we've only had a chance to just skim the surface in this call. But if you have questions for our panelists, we'd love for you to either come off mute or post something in the chat, and we'll have a little time for discussion before we ask them one final question before we close out today.
Quick question.
Yeah.
I know I didn't use my hand, sorry. I would just love to hear from the presenters, Libby and Maribel. As you were getting this work off the ground, like what would be one piece of advice you would give foundations, funders that are looking to support this type of work and help galvanize certain community members and stakeholders and, like, again, the broader ecosystem players within early childhood? What it would be like one nugget of advice you would give just as you got this work off the ground and started?
I'll go. I think one of the things that we learned is that this work takes longer than you think, and that you have to slow down to listen to the community. And so one of the things that happened as we were doing our Go Far Louisiana which is just a big systems approach for which this work is involved. Not this group of funders that we're talking with right now, but we had other funders that wanted us to tell them what the end was going to look like. And we had to say that's disingenuous to the process. And so that was an interesting dynamic, but it really, it held core to our values that providers and families know what they need. Community always knows what they need. And we have to be able to have the patience to slow down, to really listen deeply.
Thank you.
I'll have to agree with Libby. It's really, listening to the community. And as I mentioned earlier, it is customary whenever we come to the other islands, whether we do it on a monthly basis, a quarterly basis, that we do visit with the mayor. We have an opportunity for either just informal conversation with parents, with providers. In fact, last night we were invited by the providers themselves for dinner, and that was an opportunity to again listen to their concerns and also to share their successes. And you listen to them, you hear their excitement. In fact, last night we were talking about Maribel, where are we on the QRIS? Did we do good? So again, sharing and reassuring them that it is a process. There could be some changes, but the joy in me whenever I meet with providers, with families, is just listening to their stories. And hopefully I'm able to pick up the most important things. I would love to be able to address all of their concerns, really would love to, but of course that's just not possible with the very limited resources that we have. But I think just listening to them is important enough. Thank you.
Thank you. I appreciate that. Those insights.
Thank you both for those thoughtful answers. I do think what we said at the beginning about the orientation of the project, right? Centering community, centering an approach to governance that is grounded in accountability to constituents, right? Children, families, providers, communities. And I see that reflected back by both of you in your remarks. We have a few more minutes if someone else has a question for our panelists. Otherwise, I'll pass it to you, September, to close us out. So I'll just give another few seconds if anyone wants to chime in.
I put private chat to you, Rebecca, so you could vet my questions if you wanted to. I was like, I've got 2 hard questions. Do you want to look at these and tell me? So, but I will ask one, I guess. Let's see. Okay, so I was on a panel this morning, which I rarely do in this job. I did all the time in my previous job, but it was like a really big panel and like with like very large audience, National Head Start Association. And they asked this really big question, which was like, where do you think we're going? Like in 10, they said 5 years and I made them expand it out to 10 years because 5 years is too much chaos. And what would you do? And I said something that I'm not sure anybody else would agree with, and I'm interested because I think it relates to what you're doing. I said, when it comes to our systems, the thing that I feel like I have messed up on and that I would advise people to do is to look at simplification, not dumbing down or making less quality or anything like that. Like that's different to me, but simplification where possible. Like simplification for families and simplification for providers, like eliminating things we don't really need and making it easier for providers to like not have like a stack of certificates and then this lattice and ladders and like things that are hard to understand. I feel like that must relate to your work and what you're doing. And I'm wondering if it does, if you think that's a component or not a component. And if yes, have you worked like on that at all?
I mean, I think part of with our Go Far Louisiana work, as we listen to families and providers, is like, how do we have a system that meets our needs and that is easier for us to access? So, like, if I qualify for this service or that service, why do I have to just keep showing why I qualify? So, how do we have, in essence, almost a portable eligibility, portable unified eligibility system? Not in the case that if you would lose one benefit if you don't qualify for one benefit anymore, you would lose all of them, because it's a pain point as we talk about it. But I do think that there is a way to think about how do we unify the usability of the system for families. We do a lot of things right now in our state that meets the needs of the people that are operating the system, but don't meet the needs of the family. I think if you put us all in a room, we could figure it out. And in my most academic language, it is all figure outable as far as that we're concerned. Like, just listen to community and we can do this. Don't create one more wheel that has to be done. To your point, like, let's make it simple. It's not about dumbing anything down. It's really about meeting the needs of our families and our providers, because they jump through 1,000 different hoops that make no sense sometimes.
Thanks, Libby. Maribel.
I'll speak through the lens of our QRIS. So our quality recognition system, we've started this back in 2016 with our center base, and we have learned so much from 2016 to where we are now. In fact, I'm happy to share that we have actually a star 5. But now that we are bringing in our home-based providers, having looked at all of the standards, I actually, I think a few days ago, as I was reading the report from the pilot, I was like, there's got to be a way to simplify this. And so how it's gonna look like, I really don't know yet. And that's a conversation that we will have with our home-based providers, or even, and definitely with families and the community, because I do want to get their ideas and their recommendation. In fact, we are presenting the results of the pilot to our providers. It's scheduled for November, and I'm pretty sure that we will learn a lot of things from our providers, from their experiences. And one of the things that really I can't forget. We just completed a consultation meeting with our providers in Saipan. And one of the providers said, Maribel, I appreciate all of these things related to quality. I want to do it. But when you are caring for 3 children with special needs, I don't have time to post anything. And so that continues to be at the back of my head is how can we, how can we still have that quality and then also supporting the families, the children, and the providers in meeting the requirements. So that's going to be our next steps. And hopefully, and I'm very confident we will be able to have some answers to those. Thank you.
Thank you. Thank you for those examples and those reflections. Those are super helpful.
And I think it's such a great example of good governing is constantly improving, like listening, moving, letting go of things that seemed like a good idea in the past and continuing to move forward. So I love that question. Thank you, Shannon. I'm going to ask a kind of final wrap-up question, and I just want to I want to thank all of you for joining us, but especially you, Maribel and Libby. You've got big agendas you're moving. And so thanks for being here. And I think that leads to our final question, which is there's a lot of challenges within the early care and education space generally, but especially right now. Why are you choosing to spend time on the role of governing and financing as part of your own community's work? And Maribel, why don't you kick us off, and then Libby, you can close us out.
Really, the CNMI, we are a small community. We have very, very limited resources. And when we started this work, we really wanted to make sure that we are able to equitably distribute the limited resources that we have. And so that grounded the work. We want to make sure that everybody, all of our providers and all of the families within the CNMI receive the quality of care that we expect for our young children. And so, so equitable distribution of resources. We wanted to make sure that we address our huge barrier of deserts, right? Specifically in Rhoda and Tinian, which we have been able to do. The increase in our providers, specifically in Rhoda and Tinian, is a testament to the work that the work that we're doing through our initiative. And then, of course, more importantly, I think is really the opportunity to listen to the community, to the parents and to the providers, so that we continue to improve. And really, that is the reason that why we do those things. And it's not to defend the program, right, of why we do things, but really, how can we improve so that then in return, we would be able to provide the kind of support that our providers need and also the families in the different islands. Thank you.
Thank you for the good governing you're doing, Maribel. All right, Libby.
Well, the reason we're doing this is in our minds, governance and finance is the infrastructure of our system. And how do we meet the needs of our families and our providers if we don't have the infrastructure in place? And so an example is we've had increased state investment over the last 6 years. We used to have no state dollars going into our early childhood education system other than a 4-year-old program. Now we're up to about $78 million. And while that is a lot of money, we still have over 100,000 children birth to age 4 that are at risk, that are unserved. And so if we think, I mean, like all the things Maribel hit on is the very essence of why we focus on this, to make sure that there's something that we can do within these infrastructure pieces to try to serve more children. At the same time, quality is always at the essence, because we know poor quality is harmful. And we know when the quality is there in our early childhood education systems, that the return on investment is so great. And so for us, really, this governance and finance work is infrastructure work. And if you could have seen our system 15 years ago, we had no infrastructure whatsoever. And so as we unified our system, it got better, but still these pieces were around local governance, how that feeds up to the state and back. Financing at the local level feeds up to the state. It has allowed us to watch our providers and families again have a voice in the system and have pressure points along the way to help tinker, because part of governance work is tinkering. How do we get it right? It is ever changing and growing, and how do we tinker with it to get it right to meet the needs of both local and at the state level, so that we're really influencing policy. And so that's hundreds of thousands of children. And if I think about the dream, is that we will have a funding formulary at some point in my lifetime, I hope, that will meet the needs of children and families. But we're going to have the infrastructure in place so that whatever happens, and let's say revenue just goes out just gets bigger than we ever thought, we have that infrastructure in place to move. One thing we have probably for you all too, Maribel, is natural disasters happen all the time. And so there's always something that happens, and we want to be ready for whatever's next. Not to plan is to plan to fail. And we want to have a plan in place so that when there is revenue that could come in, and there is an administration that is open to governance, that we have the plans in place to move like the wind, because our families and our children deserve that.
Thank you so much. It's an honor to play a small role in supporting your respective leadership work. And like Harriet said, there's more leaders in this project to learn with and from as we move forward. And so I just want to thank you. It is about the infrastructure.
We are close to time, so I want to echo thanks and just sort of reflect back what I heard from both of you, which I think is resonant to our project values, is sort of slowing down, listening. It's iterative. This notion that it's essential infrastructure, right? Our early childhood education is essential infrastructure. The workforce are essential workers. It's complicated, complex work. And I also would be remiss if we didn't both thank our panelists, but also thank Harriet for supporting them, listening to them, implementing the vision that we have set collectively as a project, and thinking about how we can sort of grow the field's understanding of this, and support people wherever the work starts to take it through to that process. So thank you all. And I think, Rena, I'm turning it back to you. Oh,
I am
you're on.
muted. I'm muted. Excuse me. I also wanted to thank Harriet for coordinating this conversation with Rebecca and September and Maribel and Libby. It's appropriate that someone popped in the chat a comment right as we were coming to an end, that equity should always ground our purpose in creating and improving systems. And it's really inspiring to see these examples of the work that's going on in the Early Childhood Governance and Finance Project, that is giving resources and power to the local experts and working with providers and families. So thank you for bringing these examples to us, and we will be following up with registrants with a recording and other relevant information about the project. And thank you for joining us today. Have a great day.